Vertebral compression fractures are a very growing and serious problem for older adults and also for the healthcare system. Almost 50% of all women in their lifetime, as well as 25% of all men, will have an osteoporotic-related fracture in their lifetime. There really was not too much that could be done for these patients. They could be offered bed rest. They often had back braces. Back braces can be very uncomfortable to wear. Narcotic medications. And surgery was only reserved for a small minority of these patients. Those patients who, not the ones who are necessarily in pain, but the ones who are having their spinal cord being compressed. And so they're in danger of losing the ability to walk. We actually, over the past several years, developed a very high level of expertise in treating vertebral compression fractures. In fact, we've treated thousands of them at this point and have been very successful in treating these patients who are oftentimes extremely miserable. And it's one of the most severe causes of back pain that you can have that's imaginable. And this procedure that we can offer patients is a procedure that takes about 10 to 15 minutes to do. Basically it's done through a needle that we guide under X-ray vision, and we are able to, through this needle, once we get it into the fracture, we put medical superglue or bone cement in a liquid form that hardens, and it within a few minutes can take away a person's pain. And it's really it's a medical breakthrough in the way that it can do that. And it takes about 10 to 15 minutes to perform. The patient has a Band-Aid afterwards and oftentimes can walk out of the recovery room, whereas previously they may not have been able to stand up. Through treating thousands of these patients with compression fractures, one of the things that we immediately realized was that we could actually recognize where the patient's pain was coming from, even if they didn't have a fracture. A lot of the times these patients have been suffering for years, and we can pinpoint exactly where they're hurting from and confirm it through an MRI. And we can, being experts in imaging as radiologists, we know how to read an MRI better than most physicians, and also we know the limitations of the imaging technology. So we know how to really put it all together. And that's why we actually took our physical exam to another step above by adding in what's called the image-guided physical exam. We actually can examine a patient under X-rays and pinpoint where they're hurting from, and we can see anatomically where that corresponds to in their spine and immediately know where the pain's coming from. And this is something that distinguishes us from almost any other physician because we have the access to the fluoroscopy, the X-rays right in our office. We can look under real time, we call it. We can look under real time and examine the patient, and the patient doesn't even have to tell us where the pain's hurting from. We can just kind of feel on their body and they can just say that's where it is, and we'll know right away. There's many patients out there who are suffering in severe chronic pain, and they've been told that either there's nothing out there for them or they just have to take more and higher doses of pain medicines or narcotics. And one of the things that we can offer for patients who are in this much misery is spinal stimulation. This is actually a medical breakthrough. It's a device that can be inserted through minimally invasive techniques, basically like an epidural injection or an epidural approach. And we can actually thread tiny electrodes into the spine, and it's relatively painless when it's going in there. And we can actually take away someone's pain like a light switch.